Sometimes, if the diverticula become distended enough, it might rupture and form a fistula, which is a connection with an adjacent organ or structure. Since it sits pretty close to the bladder, a fistula connecting the large intestine to the bladder might form, called a colovesicular fistula, and this might result in air or stool in the urine.
जी मैं ये आपसे पहले भी एक इंडिकेट कर चुका हूँ ये प्रॉब्लम कि एक डाइवर्टिकुला जो है वो कनेक्ट हो जाता है एक फिस्टुला एक आर्टिफिशियल नाली के थ्रू जो है वो किसी और ऑर्गन के साथ। तो फॉर एग्जांपल एक कैविटी से दूसरी कैविटी तक एक आर्टिफिशियल पैसेज का बन जाना इसको हम फिस्टुला बोलते हैं। और यहाँ का जो फीकल मास है वो जो एक्सक्रीशन यूरिनरी एक्सक्रीटरी सिस्टम है उसके अंदर शामिल होना शुरू हो जाता है,
which as you might imagine is not a good thing. Treatment for diverticulitis might involve antibiotics to limit bacterial overgrowth, and some might recommend a high-fiber diet after patients have recovered. In more severe cases, though, the affected area of the colon might be surgically removed.
जी इसमें से एंटीबायोटिक्स मैंने आपके साथ शेयर कर दी हैं ऑलरेडी जो कॉमनली यूज किए जाती हैं और फर्स्ट लाइन ट्रीटमेंट जो है वो जो केसेस हैं उनमें ये यूज की जाती है। और डाइटरी जो है ना उसमें आप देख लें, अब आप मेरा ख्याल है कि डाइट प्लान आप खुद बना सकते हैं कि उसने बोला है कि यहाँ पे फाइबर को हमने मैनेज करना है, ठीक है। और सर्जिकली रिमूवल जो है वो बाज दफा मेडिकल कंडीशन एक मेडिकल इमरजेंसी वाली कंडीशन आ जाती है कि जिसमें डाइवर्टिकुला जो है ना वो रप्चर कर जाता है और जो फिल्थी मटेरियल है फीकल मास है वो जो एब्डोमेन है या एब्डोमिनल कैविटी है वहां पे वो फॉल कर जाएगा और अल्टीमेटली वहां पे इन्फेक्शन होना और फिर विद इन डेज जो है ना वो इंडिविजुअल अगर उसका वो उसकी वॉशिंग या क्लीनिंग नहीं की जाती तो इंडिविजुअल के डेथ होने के चांसेस होते हैं। तो दिस विल बी द मेडिकल इमरजेंसी और उसमें तो फिर इंडिविजुअल को सर्जिकली वहां पे जाना पड़ेगा, सर्जिकल ऑपरेशन के लिए हॉस्पिटलाइज होना पड़ेगा। और इसमें सर्जरी के अंदर डिपेंड करता है कि अगर एक डाइवर्टिकुला जो है उसको रिमूव करना है, एक से ज्यादा है उनके रिमूव करने से इशू हल हो सकता है, या ये पूरा पोर्शन जो है वो अगर अफेक्टेड हो चुका है तो फिर उसके हिसाब से उसको सर्जरी के थ्रू रिमूव कर दिया जाता है। ये भाई हमारा जो सेकंड ट्यूटोरियल था, मेरा ख्याल है अब आपको डाइवर्टिकुलाइटिस डाइवर्टिकुला इनके बारे में इनके दरमियान जो डिफरेंस है और ये प्रॉब्लम जो है वो कैसे होती है और इसको कैसे जो है वो मैनेज किया जा सकता है इसके बारे में अब आप काफ़ी अच्छे तरीके से समझ चुके हैं। तो इसके साथ फिर हम एक जो हमारा थर्ड ट्यूटोरियल है उसकी तरफ हम मूव करते हैं। इसमें भी बेसिकली हम डिफरेंस जो है ना वो क्लियर करने जा रहे हैं डाइवर्टिकुला और डाइवर्टिकुलाइटिस के दरमियान जो है।
Hey guys, and welcome to How to Gastro. In today's video, we will be talking about diverticular disease, more specifically diverticulosis and diverticulitis. So let's get started. So to begin, let's go over the definitions of diverticulosis and diverticulitis. Diverticulosis is the condition of having multiple pouches called diverticula in the colon that are not inflamed. These are outpockets of colonic mucosa and submucosa through weaknesses of muscle layers in the colon wall. So just to stop there and explain further in the pictures below, this is actually a cross-section of the layers that make up the colon. And if you look here in this little magnified box from this segment of the wall, you'll see that the colon is made up of four main layers, mainly the mucosa layer, the submucosa layer, the muscular layer, and then lastly we have the serous layer. So the mucosa and submucosa are actually the innermost layers, and then we have the muscular and serous layers, which are the outer layers. So diverticulosis, from the definition, we said that these are little pouches. So let's hop on down to this picture, and you can see these little pouches. And these pouches have a wall that is made up of two layers, and that's only the mucosa and the submucosal layers. And these so-called pouches are special because they push their way through weak areas of the muscular layer. So this little mucosal and submucosal layers push through this muscular layer, and this is actually the result, this pouch-like structure, which is called a diverticula. So diverticulosis is just the condition of having these pouches that are not inflamed. Just them being present means that a patient suffers from diverticulosis. Diverticulitis, however, is a digestive disease in which these pouches within the colon become inflamed and infected. So if you look at this image here on the right, we can see that these little pouches, they're not clear and empty anymore. They're actually full of bacteria, white blood cells, pus cells, and they're also full of fecal matter because remember, we're dealing with parts of the colon now. So in this area, we normally have feces. So feces get in there and they're able to contaminate these pouches. And when these pouches become contaminated, they become infected. And when they become infected, our patient has diverticulitis. So that is the difference between just having the pouches being present, diverticulosis, versus having those pouches which are now inflamed and infected, which is diverticulitis. Now let's talk about some signs and symptoms of diverticular disease. Most people with diverticulosis don't have symptoms. So these are usually the patients who have these pouches, but their pouches are not really causing them much problems because their pouches are there, but they're not inflamed or infected. So the patient will have no symptoms. Sometimes, in a few cases, patients may incur mild cramps, bloating, or constipation. However, when these pouches become infected, meaning diverticulitis sets in, then the patient will experience belly pain, usually on the lower left side, that is sometimes worse when you move, and this is actually the most common symptom. The patient may also have fever and chills. These are signs of infection, fever and chills. They will also have bloating and gas, diarrhea or constipation, nausea and sometimes vomiting, and not feeling like eating. So now let's talk about some complications of diverticular disease. Diverticular disease can present with painless rectal bleeding as per presence of bright red blood per rectum. So this is actually quite a common complication of diverticular disease. Usually these little pockets tend to bleed out, and when they bleed out, the patient will experience fresh blood per rectum, which means that when they do pass stool or they go to the bathroom, they recognize fresh, brightly red blood in their stool. And for my med students out there, you guys know that this is actually called hematochezia. Diverticular disease was also found to be associated with a higher risk of left-sided colon cancer. So usually the people who suffer from diverticulosis or diverticulitis also have a somewhat of a predisposition to the development of colon cancer. An abscess, which occurs when pus collects in that pouch. So this is an infected pouch in my bottom right corner, and that is an abscess of the pouch. And that is actually a single pouch which has undergone diverticulitis. Continuing with complications, we can also have an abnormal passageway, meaning a fistula between sections of the bowel and the bladder. And if you look at my picture on the left, I've shown you an example of this. Because these pouches come out of the colon wall, you can see one here, one up here, one up here, one up here. And there's also a large one down here. And then there was one here, but it actually sort of made a passageway into the bladder. And this is quite a big problem, as you can imagine, because our colon holds our fecal matter. And when this fecal matter passes from the colon into the bladder, it's going to cause quite a big problem with the urinary tract indeed. And once this fecal matter with normal flora of the colon and the bacteria within our digestive system enters our urinary tract system, it's going to be quite gnarly indeed. As well as the patient is now going to pass feces in the urine. And the patient will also suffer urinary tract symptoms such as a UTI and a bladder infection and so on. Peritonitis can also occur, and this occurs when the infected or inflamed pouch ruptures, spilling intestinal contents into your abdominal cavity. And something to note definitely is that peritonitis is a medical emergency and requires immediate care.
जी ये मैंने आपसे भी पहले भी शेयर की है। तो पेरिटोनाइटिस जो है ना वो कंडीशन का नाम है कि जिसमें स्पेशली कोई जो डायवर्टिकुला जो है वो रप्चर कर जाएगा और उसका जो स्टफ है जो फीकल मास है वो एब्डोमिनल कैविटी जो है वहां पे स्पिल कर सकते हैं, ठीक है। तो दिस इज नोन एज peritonitis, and this condition is basically a medical emergency and it requires immediately hospitalization.
So now let's talk about the diagnosis of diverticular disease. Blood tests such as a complete blood count or CBC, which will show increased white blood cells and acute phase proteins. So if these pouches are inflamed, we're going to have the white blood cells high in the blood report. We also have the acute phase proteins high, which shows signs of inflammation in the body. A colonoscopy can be done to diagnose diverticular disease, and this is actually the aspect on the colonoscopy. You can see these multiple pouches coming out of the wall of the colon. A fecal occult blood test can be done, and this is just to test the presence of blood in the stool. A barium enema can be done, and this is the picture of a barium enema on the right. So you can see where the barium is actually entered into these little pouches, and a series of x-rays is then taken after, which shows this abnormal appearance, which is the presence of these diverticula in the
जी, यहाँ पे देखें ये 3 ऑप्शंस इन्होंने दिए हैं। तो नंबर 1 सीबीसी जो है, जो हम कंप्लीट ब्लड काउंट जिसको कहते हैं, उसमें भी एक तो पैरामीटर्स ऐसे हैं कि जो हमें हेल्प आउट करते हैं ये बताने में कि कहीं पे इन्फ्लेमेशन हो चुकी है। तो ये इसको मजीद जो है ना फिर देखना पड़ेगा कि इन्फ्लेमेशन कहाँ पे है, और कुछ और जो इमेजिंग टेक्निक्स हैं उनकी तरफ फोकस करना पड़ेगा। इन जनरल जब भी किसी बॉडी पार्ट में इन्फ्लेमेशन होती है तो व्हाइट ब्लड सेल्स का नंबर बढ़ जाता है और एक्यूट फेज प्रोटीन्स जो हैं उनका जो लेवल है वो हाई साइड पे चला जाता है, ठीक है। तो बेसिकली सेकंड ऑप्शन जो है फिर हमें उसकी तरफ जाना पड़ेगा जिसमें कोलोनोस्कोपी, ठीक है, कि एक कैमरा इंसर्ट करके उससे जो कॉलन की इंटीरियर कंडीशन है उसको विजुअलाइज किया जाता है, ठीक है। तो यहाँ पे आप देखें बड़ा क्लियर जो है ना वो हमें इसमें पॉकेट्स या सैक लाइक स्ट्रक्चर्स जो हैं वो नजर आ रहे हैं। इसके अलावा फीकल अकल्ट ब्लड जो है वो फीकल सैंपल जो है उसको सबमिट करवाया जाता है और उसमें जो ब्लड का होना जो है वो भी उसको जज किया जाता है कि either it is existing or not, and if it is there it is indicating the diverticulitis. And third test is using the radioisotopes in which a barium solution is fed, and ultimately the diverticula will show some color, and this color is a few images are taken, and through these images we can clearly see that diverticula are present there. So these are 3 options.
And we can also do a CT scan to confirm the diagnosis. And finally, let's talk about the treatment options in diverticular disease. In uncomplicated diverticulitis, the treatment is antibiotics to treat the infection, a pain reliever such as acetaminophen, also known as Tylenol, and a liquid diet for a few days while the bowel heals is suggested.
जी, अब हम डायवर्टिकुलाइटिस है उसको 2 टाइप्स में डिवाइड कर सकते हैं। एक को हम कॉम्प्लिकेटेड बोलेंगे और एक को अनकॉम्प्लिकेटेड बोलेंगे, ठीक है। अनकॉम्प्लिकेटेड के अंदर जो है वो यूजुअली एंटीबायोटिक्स का कोर्स करवाया जाता है और उसके साथ साथ अगर पेन होती है तो पेन किलर को यूज किया जा सकता है, और कुछ दिन के लिए जो है वो जो लिक्विड डाइट है उसके ऊपर इंडिविजुअल को शिफ्ट किया जाता है। तो पर्पस इज टू रिलैक्स द बाउल सो दैट इट कैन बी हील्ड। इन केस ऑफ कॉम्प्लिकेटेड डायवर्टिकुलाइटिस, कॉम्प्लिकेटेड हम किस सेंस में बोलेंगे कि देयर विल बी अपीयरेंस ऑफ ब्लड इन द फीकल मास, यू कैन से ब्लीडिंग इज देयर, ठीक है। तो अब इस वाले केस में सर्जरी जो है ना वो एक ऑप्शन आएगा कि जिसमें डिजीज्ड एरिया जो है इसको रिमूव कर दिया जाता है, ठीक है। और इन सम केसेस सर्जरी जो है वो कुछ जो अदर प्रॉब्लम जो इसकी कॉम्प्लिकेशंस कह रहे हैं, लाइक एक फिस्टूला बन चुका है कि जिसने कनेक्ट कर दिया जाके ब्लैडर के साथ इस लार्ज इंटेस्टाइन के पोर्शन को, तो उन चीज़ों को या कुछ जो डायवर्टिकुला है जहाँ पे इन्फेक्शन हो चुका है तो उनको रिमूव करना, उस पर्पस के लिए भी सर्जरी की जाती है। तो बेसिकली ये हमारे पास इसके जो है वो ट्रीटमेंट ऑप्शंस आते हैं। तो ये काफ़ी इंफॉर्मेटिव प्रेजेंटेशन थी कि इसमें हमें दोनों का जो है वो क्लियर डिमार्केशन भी की गई है कि व्हाट इज डिफरेंस बिटवीन डायवर्टिकुलोसिस एंड डायवर्टिकुला, और उसके बाद फिर इसकी जो डायग्नोसिस है उसके ऊपर एम्फिसाइज किया गया, उसमें 3-4 मेथड जो है वो बताए गए हैं, और लास्ट में जो है ना वो ट्रीटमेंट ऑप्शंस की बात की गई है। तो अब मैं दोबारा जो है वो अपनी जो प्रेजेंटेशन है उसकी तरफ मूव करता हूँ, और हम देखते हैं कि हमारा जो डाइटरी ऑब्जेक्टिव होता है डाइटरी मैनेजमेंट के अंदर, डाइट थेरेपी के अंदर। तो इन केस ऑफ डाइवर्टिकुलाइटिस वी वांट टू reduce the fecal output. The first objective is to reduce the fecal output, and how it is possible? Yes, इसमें दो ऑप्शन है। नंबर वन कि जो फिकल बल्क है इसमें फाइबर का रोल ज्यादा है, तो फाइबरस पार्ट वाली फूड्स हैं उनको इस वाली केस के अंदर कम इस्तेमाल करना है। तो फाइबर ज्यादा इस्तेमाल कब करना है? जब डायवर्टिकुलोसिस को हम रोकना चाहते हैं एज अ प्रिवेंटिव स्ट्रेटेजी। लेकिन जब हम क्यूरेटिव साइड पे आते हैं तो फिर हमें फाइबर जो है उसको कम करना होगा। तो so this diet is designed to reduce the fecal output in patients with the diverticulitis, और फिजियोलॉजी जो है इसको हम ऑलरेडी जो है वो काफी हद तक जो है वो कवर कर चुके हैं। सेकंड नंबर पे अब मॉडिफिकेशन में हम देखें तो वी वांट टू रिस्ट्रिक्ट फाइबर एंड रेजिड्यूज so that the frequency and volume of fecal output can be reduced। ठीक है, और इन केस अगर हम देखें तो शुरू में हम एलिमेंटल डाइट या क्लियर लिक्विड डाइट जो उसकी तरफ जाएंगे, और फिर जैसे जैसे सिस्टम जो है वो बेहतर होना शुरू करे तो वी कैन गो टुवर्ड्स ब्लेंड डाइट। ब्लेंड डाइट जो है उसमें आप स्पेशली जो स्पाइसेस और फैट का लेवल जो है उनको आप कंट्रोल करेंगे और फाइबर का लेवल कंट्रोल करेंगे, तो अल्टीमेटली इससे भी जो है वो किसी हद तक मैनेजमेंट जो है वो बेहतर होगी। और नट्स, सीड्स और ऐसी फूड्स के जिनके अंदर फाइबर का कंटेंट ज्यादा है, या जिनके अंदर फैट का कंटेंट ज्यादा है, या जिनके अंदर ये रॉ वेजिटेबल्स की स्पेशली बात की गई है तो इसमें फाइबर का कंटेंट ज्यादा है। नट्स और सीड्स की बात की गई है तो इसमें फैट का कंटेंट ज्यादा है। तो बेसिकली जो है वो इनको विद कॉशन जो है वो यूटिलाइजेशन जो है वो किया जाता है। इवन जो है कुछ अर्से के लिए इनको लिमिट कर दिया जाता है, और जैसे ही इनका हीलिंग का प्रोसेस जो है वो किसी हद तक हो जाए और जो फिजिकल इंडिकेटर्स थे वो किसी हद तक कंट्रोल में आ जाए तो फिर इन चीज़ों को जो है वो आहिस्ता आहिस्ता इंट्रोड्यूस करवाया जा सकता है। तो अगर हम डाइटरी एडिक्वेसी की बात करें तो इसमें चूंकि फ्रूट्स एंड वेजिटेबल्स हैं ये रिच सोर्स हैं वाइटामिन्स और मिनरल्स का, तो जब हम इनका इनटेक जो है वो कम कर रहे हैं तो अल्टीमेटली देयर आर चांसेस ऑफ डेफिशिएंसी ऑफ विटामिन्स एंड मिनरल्स इन दी बॉडी। तो नंबर एक तो ये हो गया, और नंबर दो ये भी है कि जब बंदा एक खास डिजीज में से गुजर रहा है उस वक्त कुछ न्यूट्रिएंट्स की रिक्वायरमेंट जो है वो बढ़ जाती है, और स्पेशली विटामिन्स और मिनरल्स जो हैं ये बॉडी के अंदर बहुत सारे प्रोटेक्टिव काम कर रहे होते हैं, बहुत सारे एंजाइम्स, वो एंजाइम्स उनका ये एसेंशियल पार्ट है। ठीक है, तो अल्टीमेटली उनकी एक्टिविटी जो है वो डिस्टर्ब होती है। तो ड्यू टू इंक्रीज्ड डिमांड और ड्यू टू less intake of foods enriched in dietary fiber, we have to suggest or we have to move for vitamin and mineral supplements, और इसमें स्पेशली स्कॉर्बिक एसिड और फोलेट सप्लीमेंट्स जो है वो उनका जिक्र किया गया। और लास्टली अगर हम देखें तो हम फूड चॉइसेस देखते होते हैं कि जिसमें हम एक तरफ डाइटरी ग्रुप्स को और फिर उनके अंदर से जो है ना वो कुछ गुड फूड्स और कुछ बैड फूड्स को सेलेक्ट करते हैं और उनको हम फूड अलाउड और फूड नॉट अलाउड का जो है वो या फूड रेस्ट्रिक्टेड का नाम दे देते हैं। तो इन केस ऑफ सीरियल ग्रुप या ग्रेन ग्रुप वी आर लिमिटिंग दी foods which have high fiber content, and mostly cereals are rich in insoluble dietary fiber, whole wheat bread, bran bread, chapati. Chapati is made from whole wheat flour, brown rice, whole grain breakfast cereals, and even porridges. So these are restricted, whereas foods allowed are those in which fiber level is low, or basically which are more refined variants. So these can be breakfast cereals, not made from the whole grains, kheer, vermicelli, pasta products, noodles. These are the stuff in which fiber content is low. In case of milk and milk-based groups, almost everything is allowed except the fat content should be low. सो इसमें मलाई या क्रीम या मलाई जो है ना उसका इस्तेमाल डिस्करेज किया जाता है। लो फैट जो वेरिएंट है उसको यूज किया जाता है। पर्पस क्या है कि अगर हम इसको लिमिट करते हैं तो अल्टीमेटली बॉडी के अंदर जो है वो कैल्शियम की डेफिशिएंसी होने के चांसेस हो जाएंगे। मीट के अंदर हमने देखा है कि स्पेशली जो रेड मीट है ना उसमें चूंकि फैट का लेवल जो है वो ज़्यादा होगा और उसके अंदर कुछ नाइट्रोजनस कंपाउंड्स हैं वो ज़्यादा होंगे जो कि प्रॉब्लमेटिक हो सकते हैं, तो इसलिए उसको लिमिट के साथ अलाउ किया जाता है। और स्पाइसी, ऑयली, फ्राइड वेरिएंट्स जो है, हाईली सीजनड वेरिएंट्स जो है जिनमें ज़्यादा स्पाइसेस लेवल है हमको डिस्करेज किया जाता है। दाल की अगर हम या अदर पल्सेस की बात करें तो इसमें भी अगेन फ्राइड और स्पाइसी वेरिएंट जो है वो उनको डिस्करेज किया जाता है, डिसअलाउ किया जाता है, और नॉर्मली जो है वो आप नॉर्मली जो पल्सेस हैं उनको यूटिलाइज कर सकते हैं। वेजिटेबल्स में भी अगेन सेम मैसेज है। नॉर्मली वेजिटेबल्स दे आर रिच इन डाइटरी फाइबर, और स्पेशली कुछ वेजिटेबल्स के अंदर फाइबर लेवल जो है वो स्पेशली ज़्यादा होता है। तो अल्टीमेटली डेली डाइट के अंदर इनको जो यूज़ करना होगा उनके अंदर जो फ्राइड वेरिएंट है, रॉ वेरिएंट है और स्पाइसी वेरिएंट जो है उनको जो है वो डिस्करेज किया जाता है। तो these should be boiled, these should be cooked in low fat. In this way, these are best. So instead of using raw vegetables, we can go towards the cooked variant, and cooked variant should be having less quantity of fat and spices. Fresh fruits, of course, we generally recommend use of fresh fruits and vegetables rather than their juice or extracted variant. So in this case, all fruits are allowed, but preferably which are low in fiber content. Dry fruits, nuts, and seeds, I have already told that these can be a rich source of fiber, high fat content, and some dried fruits like prawn or fig, these are good laxative agents. So these type of things can be problematic, and basically these are restricted. Fats are allowed, but with moderation. Desserts, of course, these are also allowed, but desserts having the high content of fat and garnished with nuts and seeds, these should be avoided. In case of fluids and drinks, the main objective is to restrict those beverages which promote the constipation or the dehydration. So ultimately, in case of dehydration, the problem of constipation can be there. तो ये चाय, स्ट्रॉन्ग टी जो है ना ये अल्टीमेटली कॉन्स्टिपेशन को प्रमोट करती है। हाई इंटेक का कॉफ़ी जो है ना ये भी इसी चीज़ को प्रमोट करती है, और अमूमन इसके बाद जो पानी पीने की डिज़ायर है वो कम हो जाती है और डिहाइड्रेशन फर्दर होने के चांसेस हैं। तो इन ड्रिंक्स को इसलिए डिस्करेज किया जाता है। नॉर्मली भी जब आप चाय वगैरह पिए तो पानी जो है वो पहले एक आध ग्लास पी लेना चाहिए, क्योंकि उसके बाद जब फिर आपकी पानी की जो डिज़ायर है वो नहीं रहेगी। यू विल फील लेस थर्स्ट एज कंपेयर टू आफ्टर यूजिंग स्पेशली दिस टाइप ऑफ ड्रिंक्स। तो अब लास्ट में भाई हमारे पास जो है वो ये हमारा जो डाइटरी रेजिमेंट था वो कवर हो गया। तो एक इसकी जो लास्ट वीडियो है, स्टेप्स टू हील द डाइवर्टिकुलाइटिस नेचुरली, इसको एम्फिसाइज करेंगे, और जैसे ये वीडियो जो है वो खत्म होगी, आपका जो सेशन है आज का लेक्चर है वो कंप्लीट हो जाएगा। तो इसके बाद मैं इसको स्टफ जो है ना, इसको आपके साथ YouTube के ऊपर भी मैं शेयर कर दूंगा, और लेक्चर वर्जन जो है वो आपके पास ऑलरेडी अवेलेबल है। तो थैंक यू ऑल भाई, आप काइंडली इसको विजुलाइज करें, और उसके बाद जो है वो आपका ये सेशन जो है वो कंप्लीट हो गया।
This is Dr. David Jockers, and today we're doing a short training on 4 steps to heal diverticulitis naturally. Diverticulitis is an extremely painful digestive disorder that many people are dealing with, particularly people as they age, they become more and more prone to diverticulitis. And we're going to go through really 4 key steps we need to do in order to heal this condition naturally. And so if you don't know me, I'm Dr. David Jockers. I am a doctor of natural medicine. I work with people all around the world, and I speak all around the world at churches, organizations, on a lot of different online summits and online programs. This is my beautiful wife, Angel, and my baby boys, David and Joshua, twin boys. And we're just passionate about life and passionate about helping people get well and stay well naturally. And so we look at diverticulitis. What we know is that we all have diverticuli. These are little pouches in our intestines. And these naturally occur, but we get more of these. They occur more frequently if we're not taking good care of our digestive system. And not only that, not only do we get an increase in these diverticuli, but we also develop infections with the diverticuli, because these are little houses for bacteria. And if we have dysbiosis, or a poor balance of microbes in our intestines, then we're going to have issues here. We're going to certainly develop inflammation and infection in these regions, and it can be extraordinarily painful. And so we're going to go through the strategies we need to take in order to heal this naturally. Really, how does somebody know that they have diverticulitis? Well, typically, a medical doctor will do detailed exam to actually see this. Particularly, they're going to do something like an endoscopy, where they actually go up your rear end with a little camera, and they take pictures of the intestines. And that's how they will actually diagnose diverticulitis. But we know the major symptoms are going to be things like cramping, bloating, tenderness, particularly in the left side of the abdomen. The lower right side is typically associated with appendicitis, whereas the lower left side is typically associated with diverticulitis. And that pain can be relieved by passing gas or bowel movement. Individuals with diverticulitis with the active infection oftentimes will have diarrhea, they'll have mucus in their stool, nausea, they won't want to eat, and they'll have a continual need to eliminate, so they'll want to constantly be going to the bathroom, kind of that diarrhea symptom. That's very common when somebody is in an acute infection: diarrhea, nausea, mucus in their stool, and a continual need to eliminate. Sometimes they can run a fever too if there's major infection there. So what are the major causes? Well, obviously a bad diet, particularly low in fiber, high in processed foods, high in grains. Gluten sensitivity is a really common issue with this. Individuals that are dehydrated, which is a chronic epidemic. Low in magnesium, because magnesium is so key for bowel activity, for bowel muscle contraction. That's a really common issue. Oftentimes, individuals that are under a lot of stress, because when we're under a lot of stress, we use more water, we use more magnesium. So stress will actually cause dehydration, magnesium deficiencies. Some people are a little bit more genetically prone to it. And we all have genes, but genes only play 30% of the role in our disease outcomes and our quality of life. So 30%. The other 70% is really how we program those genes with the environment, the diet, the lifestyle, the stress, the nutrition, things like that. All those factors play a role in how the genes express themselves. Gallbladder disease. So people with issues with their gallbladder are higher likelihood of developing diverticulitis. Obviously, gallbladder is a major digestive disorder, typically associated with liver problems too, and a number of things, thyroid problems. So those all go hand in hand. People are obese. Obesity is going to be very much related. In fact, we know that fat cells themselves will secrete, basically they're going to release inflammatory compounds. So we're going to have more inflammation the more weight we have on ourselves. Coronary artery disease, people with CAD or coronary artery disease are much more likely to have diverticulitis. Why again? Coronary artery disease, very much associated with magnesium deficiency, as is diverticulitis. So 4 steps to heal. Number 1, remove gut irritating foods. We're going to use a food elimination diet for that. Number 2, gut soothing nutrition plan. The right nutrition plan to help soothe the gut, to help heal the diverticuli. We need the right gut healing supplements to help support and strengthen the gut wall. And we need lifestyle strategies that we can apply to really get to the root cause of the problem, correct and stabilize it, so we don't have problems with our diverticuli and in general with our digestive system again. So let's take it step by step. Number 1, get rid of the gut irritating foods. So an elimination diet. Most gut irritating foods, here they are: gluten, really grains in general, particularly gluten, although there's gluten molecules in all grains. So I'm a big fan of a grain-free diet, but particularly, you know, in the immediate, somebody can immediately get off gluten, and that will play a big role in reducing the frequency and the severity of diverticulitis. Dairy is another big one. So when I have somebody with diverticulitis, I take them off all dairy except for ghee. Why ghee? Because ghee is clarified butter. Butter has trace amounts of lactose, casein, and whey. Ghee is completely free of lactose, casein, and whey. Those are the most inflammatory provoking agents in dairy. So the actual dairy fat is really good for the body. It's short chain. Most of it is short chain fatty acids like butyrate, which are extremely anti-inflammatory for the gut. So I like using ghee. Also fat soluble vitamins, vitamin A, vitamin E, vitamin D, choline in there, really good for the brain. So a lot of good stuff in there. So ghee is good. Refined sugar, take them off the sugar. Eggs, unfortunately, a lot of people have issues with eggs. So at the beginning, I will take people off eggs, corn, soy, vegetable oils, all these ones, canola, cottonseed, safflower, peanuts, soybean, corn oil, all real bad. We'll come off of those. As I said, they're all grains. Shellfish, a lot of people have issues with shellfish. They don't know it. They have issues. Tree nuts, so that's going to be obviously things like almonds, pecans, walnuts, stuff like that. We're going to take people off tree nuts. And also with diverticulitis, we're going to take them off seeds. So we take them off things like pumpkin seeds, sunflower seeds, flax seeds, unless it's really well broken down, like for example, ground really well. Why do we want to take them off seeds? Seeds have more of a tendency to slip into those loose diverticuli where they can cause infection and cause more pain. So we want to take people off those. Legumes. Legumes have a high level of lectins, anti-nutrients. So we take people off the legumes. And then nightshade vegetables. A lot of people that have challenges with nightshades. We come off of those for a period of time. Some of these foods we're going to add back in. In general, we definitely want to stay off of gluten, as well as use vegetable oils. Things for healing the gut. So we love bone broth protein powder, bone broth in general, collagen protein, all that really good. Coconut oil. Coconut oil is rich in medium chain fatty acids, particularly lauric acid, which turns into monolaurin, which is a fantastic anti-yeast agent. So it helps to reduce yeast levels. Also just really, really good for reducing inflammation in the body. So we love using coconut oil. Apple cider vinegar. Apple cider vinegar is rich in acetic acid, which is very good for stimulating the right amount of digestive juices. And people with diverticulitis are not producing the right amount of digestive juices. We talked about how there's a big association with gallbladder disease and diverticulitis. Well, basically, we need good secretion of stomach acid to protect the gallbladder, or else we're going to be at risk for developing a gallbladder problem, a sluggish bile problem. Apple cider vinegar is great for stimulating stomach acid, helps stimulate bile release, bile production and release, pancreatic enzymes. So it really helps get the digestive process going, stimulates all those digestive juices, as does ginger. Both things are amazing. Ginger is really, really good for interacting with. Now, what are the best supplements? Well, we talked about stomach acid, how key that is. Typically, people with diverticulitis, they're not producing stomach acid. They're producing a very, very small amount. And if that's the case, then we're definitely.
So these are commercially used gut healing supplements available, especially in developed countries. So we are not going to focus more on these. However, these things are also important as a dietitian. That healing process should also be encouraged or speed up.
definitely going to need support. So aloe vera, really good, as well as in between meals. Yeah, more really key. Avocados, great source of fiber.
So these are basically last option. Or fourth strategy should be lifestyle modification. So we should go towards use of foods which are rich in fiber content, and also optimal hydration should be there. Not too much water and too less water, because we want to regulate the bowel movement. And of course stress is associated with the reduction in the production of various enzymes, hormones, various type of secretions which are important for the digestion and metabolism of food. And similarly we should also focus on healthy bathroom habits, and these healthy bathroom habits are further elaborated in next slide.
For easy on the digestive system, but really more like puborectalis muscle, and allows for very easy elimination. There's a lot less straining, and it just easily falls out with gravity. So this is what I would recommend, especially if you're somebody out there who's got hemorrhoids or just has to strain a lot at the toilet bowl. I would highly recommend doing something like this. Very simple and easy. Just get a little stool and put your feet up on it, and it works great. You know, our ancestors, they squatted down all the way down, and they'd have a hole in the ground, and that's how they would poop. And so that's just natural. And it wasn't until, you know, more recently, the last few hundred years, where we've actually created this kind of 90-degree angle. In a lot of other countries, like Asian countries, they have, or this sort of the toilet bowls are much closer to the ground, so you get this kind of squat going. So anyways, that's how they caught the squat. Very important for diverticulitis. And
thank you, Alvin.